Hello, everybody. Blake Case here with the Women's Foundation of Mississippi, and I'm so glad to be joined by Dr. Michelle Owens today for a Thrive in 5 conversation. Dr. Michelle Owens is a board certified OB-GYN and a maternal fetal medicine specialist. She's a professor and a division chair of maternal fetal medicine at the University of Mississippi Medical Center. She has more than 20 years of experience practicing medicine. You've probably heard her on MPB's Southern Remedy on the radio. And of course, we are super lucky to have her serve on the board of directors for the Women's Foundation of Mississippi. So welcome to Dr. Michelle Owens. Thanks for being here.
Thank you so much for having me, Blake.
Yeah. So obviously, there is so much being said right now about COVID-19 and the vaccines. There's a lot of information going around. There's a lot of misinformation going around, unfortunately. But I wanted to ask you, as somebody that's an expert in this area, like I said, 20 years worth of OB-GYN and fetal medicine, what do we know about the vaccines?
Well, I'm glad you asked that question because I think it acknowledges a big issue out there. There is such information. We've been in information overload since COVID, and 20 years of medical experience is one thing. We haven't had 20 years of experience with COVID. So we've kind of all been in a unique situation where we've had to learn as we go. The good thing is that there is a portion of this process that's in our rearview mirror, right? And so we have to use that information to kind of better inform our decisions as we go forward. So things that we do, number one, we know that the vaccine is safe and it's effective. While it does not prevent COVID infection altogether, it does decrease the risk of serious illness and death in those people who are exposed or who contract the virus, which is a big, big deal. The other thing is that we know that it is a very important weapon in our fight against this virus. It is not the only answer, but it is a huge piece of the puzzle. And we're all really grateful to have this in addition to other therapies. But this is really important for a preventive measure and for protection of everyone so that we finally get through this.
Absolutely. Well, thank you for addressing that. And, just to hear that again, that we know it's about its safety and its effectiveness is such a huge thing. And like you said, 18 months or so into this, it's our biggest tool that we have right now to fight it. So let me ask you something else. We're hearing about this a lot, but let's say there's a pregnant woman and she's done her research on the vaccine and she's really quite interested in getting it for her protection. She wants the vaccine, but she's worried about some of its effects on her unborn child. What would you say to that patient or to that person?
Well, the first thing I would say is kudos to you for considering the vaccine. I think that is pretty common for pregnant women to be a little anxious or concerned about anything. Think about it. Any that you can think of, they always say, and if you're pregnant, please ask your doctor. And so pregnant women in general are always hesitant or reluctant when it comes to taking additional medications or other things during pregnancy. So I would say, number one, that's not unfounded for people to have that concern. That's a normal mommy thing. Mommy guilt is real. None of us want to do anything that would have an untoward effect on our babies. However, and I say this all the time, the best way to have the healthiest baby is to have a healthy mom. And so we are innately, as mothers, designed to provide protection to babies. And we also have inside of us the placenta, which is an additional layer of protection that filters some of the things that moms are exposed to or keeps that environment separate from the baby. So babies already have a natural layer of protection. But additionally, the health of the mom is really important and needs to be highlighted as the best way to get a healthy baby. We know that women who are infected with COVID during pregnancy have much higher rates of dying or being hospitalized than women who are not pregnant. So this is a very important issue for pregnant. the substance that is injected in the vaccine actually gets to the baby. However, one of the interesting things that can get to the baby are the antibodies that the moms build up as a result of having their immune systems revved up to fight the virus if they are exposed. So you don't get anything from the vaccine that actually gets to the baby, but the protection that we develop as a result of the vaccine actually can get to the baby and provide an extra layer of protection.
Yeah, that's fantastic. So those good antibodies that are sort of our response to the vaccine, that can get to baby, but the actual raw materials of the vaccine, that never gets to the baby, right?
Right, absolutely.
Yeah, that's fantastic. And I think there's been so much about that. So it's good to have that cleared up from you. We appreciate that.
I hear that all the time. I hear that all the time from my patients. Very valid concerns. And that is one of the joys, is being able to have the opportunity to sit down and talk to women to help kind of clarify some of the information that's out there, to sift through this big mountain of information, and to be able to reassure them that there's nothing that you are going to get from the vaccine that actually puts your baby or your pregnancy at risk.
One of the other things that we're hearing a lot about, and a lot of misinformation about, and myths and that sort of thing, is this fear around fertility or infertility. We're hearing a lot of people say, well, I'm scared that the vaccine is going to cause infertility, and so I'm not going to get it. And so I wanted to get some, answers from you about that. What do we know about the vaccine and fertility?
So again, I think this is one of those instances where what we have experienced is really helpful. We have data and information from, millions of people who received the vaccine. The vaccine has not been shown to cause infertility in men or women, because both of us contribute to the concept of fertility. It's not just a woman thing, that's a human thing. Vaccine has not been shown to cause problems with fertility in men or women. It does, however, protect us from COVID, and COVID has been known to cause death, and you can't reproduce if you're dead. So I think it's really important to kind of put the emphasis on where it needs to be. And, there are some people who say, well, we don't know long-term. We don't know long-term, but in order for us to get to long-term, we've got to survive this virus. And what we do know is that of the people who have been in the trials that took place before we knew what COVID was as a country, before it reached pandemic status, and also even now through the more rigorous research that has taken place since people have been getting vaccinated, and with all we've learned, the issue of fertility has not existed. It was a theoretical idea that was proposed on a social media platform, and I am amazed at how it's just ballooned. And it worries me even more because it actually, I feel like, has been weaponized in order to keep people from getting access to something that really could make the difference between whether or not they live or die, or how severe their disease may be if they are infected with COVID. And that, to me, I think it's unconscionable. So I think it's really important that people understand that you do not have to sacrifice your fertility or your life by getting this vaccine.
Yes, that's fantastic to hear. And, I think it is valuable to remind people that of the million, we do have data on this vaccine now. We have millions of pieces of data. And to your point, that's just not an issue that has been reported widely. It's not an issue that we're seeing. So that's good for you to clear that up for some of our audience. So we appreciate that. Well, Dr. Owens, thank you so much for taking some time out of your day. We thank you for all your hard work and for answering some of these questions about the vaccines and for all that you're doing. So thank you so much for joining us.
Absolutely. It was my pleasure. Happy to do it. Always willing to be available to kind of help people sort through this thing. It's not been easy, but I do believe that together we'll get through it. There's not one answer. There are a lot of different things that we all have to do, but vaccination is a really important, a vital, critical part of that.
Yeah, absolutely. Thank you again so much.